Is it possible to have cramping and no period if not pregnant?
Hey there, welcome to our video. Today, we'll be discussing a common question. Is it possible to have cramping and no period if not pregnant? Cramping is a sensation many people experience, but it doesn't always mean pregnancy is the cause. Let's dive in and explore the various reasons why cramping can occur without pregnancy.
Menstrual cycle and cramping.
During the menstrual cycle, the uterus undergoes changes in preparation for a possible pregnancy. Cramping is a common symptom experienced by many individuals during menstruation. It is caused by the uterus contracting to shed its lining if fertilization and implantation of an egg do not occur.
Reasons for cramping without pregnancy.
Hormonal imbalances. Hormonal imbalances can lead to irregularities in the menstrual cycle, including missed or delayed periods. These imbalances can cause cramping without the occurrence of menstruation. Factors such as stress, excessive exercise, weight fluctuations, or certain medical conditions can disrupt the delicate hormonal balance. Ovulation cramping may also occur during ovulation, which typically happens around the middle of the menstrual cycle. Ovulation cramps, commonly known as Mittelschmerz, are caused by the release of an egg from the ovary. These cramps are usually mild and localized to one side of the lower abdomen. Pelvic inflammatory disease, PID. Pelvic inflammatory disease is an infection of the reproductive organs, usually caused by sexually transmitted infections. In addition to symptoms such as pelvic pain, abnormal discharge, and fever, cramping can be a sign of PID. If you suspect PID, it is essential to seek medical attention promptly. Uterine fibroids. Uterine fibroids are non-cancerous growths that develop in the uterus. Although they are typically benign, they can cause various symptoms, including cramping, pelvic pressure, and heavy menstrual bleeding. If you experience persistent cramping along with other symptoms, it's advisable to consult a healthcare professional. Endometriosis. Endometriosis is a condition in which the tissue lining the uterus grows outside the uterus, commonly affecting the pelvic area. It can cause chronic pelvic pain, painful periods, and cramping even in the absence of menstruation. If you suspect endometriosis, it's crucial to consult with a healthcare provider for an accurate diagnosis and appropriate management. Irritable bowel syndrome, IBS. Cramping can also be associated with irritable bowel syndrome, IBS, a common gastrointestinal disorder. IBS can cause abdominal pain, bloating, and changes in bowel habits. These symptoms may lead to cramping that is unrelated to pregnancy or menstruation. Other factors. In addition to the conditions mentioned above, other factors such as stress, ovarian cysts, gastrointestinal issues, or side effects of certain medications can contribute to cramping without the presence of a period. To summarize, experiencing cramping without a period is indeed possible and can have various underlying causes. While pregnancy is often associated with cramping, it is not the only explanation. Hormonal imbalances, ovulation, pelvic inflammatory disease, uterine fibroids, endometriosis, irritable bowel syndrome, and other factors can all lead to cramping without pregnancy. If you are concerned about your symptoms, it is always recommended to consult with a healthcare professional. They can evaluate your specific situation, provide a proper diagnosis, and guide you toward the most appropriate treatment options. Remember, each person's